weight loss drugs, Wegovy, Ozempic, the GLPs, all right? You know how I feel about those drugs, but they're now 80 to 90% less than before. A popular fertility drug, 83% cheaper. Now that could literally be a life changer for a family. So who is TrumpRX for? Why should we see it as a positive? Let's ask the administrator of the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz. Good to see you, Doc. Thank you for joining me tonight.
Good to see you, Chris. Let's answer that first question. Everyone could benefit from TrumpRX.gov. In fact, I think as we build more products into the site, you should check it before you buy a medication, because for sure it'll drive transparency into the system. And in addition to the wonderful savings that you highlighted, that may be the biggest benefit. By forcing transparency into how we buy drugs, you don't have the middlemen playing games. Insurance companies can actually check the price. They can drive for that result, employers as well. But most importantly, cash-paying Americans. The folks that often get caught in the middle, they may not have great insurance, they don't get access to these medications. And let me pick on two that you just mentioned because you have them in there. 1 in 3 babies, Chris, sorry, 1 in 3 families don't have the number of babies they want. They're underbabied. And with the medications being so expensive, they can't afford to have the children they desire. The 90% reduction in gun left allows that to become an issue of the past. They can actually buy the medications with cash, which is how it's often done anyway, and they can afford it and make those babies. And the other big one is you have at the top there Wegovy and Ozempic. Look at those, down 90% roughly. And there's a pill now. You don't have to get the injection. There's a weight loss pill, and that's about $150 rather than $1,200. And we think if we can get these medications out there for folks who need them, we could lose 100 million pounds of weight this year, just this year. And that would actually save the healthcare system that I'm in charge of managing the finances of money. Within a year or two, we would have saved the money that it costs us to provide these medications at a discounted price, even to Medicare and Medicaid patients. And remember, Medicaid patients don't have to pay. They'll get the medication if they're overweight, they're living in poverty or they're in vulnerable period, and they desperately need help. We'll be able to supply it. As that's the opposite of what's happening today, where the #1 zip code for the weight loss medications is the Upper East Side of Manhattan because they can afford it.
And yeah, I got a place there. I don't want to hear it. Okay, it's not me, Doc. You understand? It's not me. So look, I don't have a knock on this. We'll see how it plays out and how many people use it and what its net effect is. My question is, do you have any plans, or have you heard any plans to do something like this with insurers? Because the one knock, I'm not to criticize TrumpRX, but because it's drug prices, it doesn't do as much to reduce overall national spending on healthcare and pharmaceuticals, because it's not really about those with insurance. It's about those who get caught, as you were saying, who have to pay cash out of pocket. Could you do the same thing? Yes. Is there the will to do the same thing with the insurers?
Yes and yes. And just to be crystal clear about drug prices, they're a major driver of higher insurance costs. And 1 in 3 Americans turn away from the drugstore. They can't afford the medications they're prescribed. And Ed Korstein, a wonderful engineer, and Joe Gebbia, who built Airbnb, by the way, they're the ones who made the site come alive. They've already had millions of Americans use the site, unique individuals, and there have been millions of dollars of savings just in 24 hours. So there's no question this is going to be a massive issue. And you mentioned it for the midterms. Every time an American goes to TrumpRX.gov and saves money or is able to get a medication they couldn't afford otherwise, they're going to remember that the president made a difference because he forced America to deal with the catastrophe of paying 3 times more for our medications than any other country on the planet. He forced most favored nation drug pricing into the system by getting all those insurance companies to come together. And to your point, Chris, that's the power to convene. So you pulled all the drug companies together, you look them in the eyes and say, guys, it's wrong. Try to defend it. They can't. And they say, you know what? And we were there. You know, Chris Klump, John Brooks, and Hernandez, the big team that negotiated, same discussion every single time. The drug manufacturers, when confronted, said, we knew one day you'd come knocking. You know, we didn't know when, but we knew what would happen, and President Trump was the first to knock on the door and say, give us our money back. The insurance companies, we've actually already started to do that, Chris. We went after something called prior authorization. Now, just to remind everybody, remember that horrible tragedy last year when they murdered the insurance executive in New York in cold blood? Yeah. The ostensible reason for that was, but U.S. Health, United Healthcare, they were upset. The murderer, and he was a murderer, assassin, they was upset that there was a prior authorization going on, which means you're having that precious discussion with your doctor about whether you have cancer. And all of a sudden, the long arm of insurance comes in and disrupts that that covenant that you have with your doctor in their office. And the insurance company says, well, maybe you don't get that test to see if you have cancer. You got to wait a couple weeks. That's a nefarious and upsetting process.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.